Hello, everyone, and happy Wednesday. Thanks for joining us tonight. My name is Jasmine Patel, and I'm the Policy and Outreach Director for the Partnership to Advance Cardiovascular Health, which we call PATCH for short. PATCH is a coalition of a number of doctor, nurse, and patient organizations that work for better healthcare for people living with heart disease. You can see on this slide the many organizations we collaborate with. PATCH's mission is about people. We want to make sure that anyone who has had a heart attack or stroke, or anyone who's at risk for having a heart attack or stroke, can get the care they need to live long, productive lives. In the course of our work, we are so fortunate to meet and work with amazing doctors, nurses, and people living with heart disease. These clinicians and patients are gracious enough to take time from their busy schedules to advocate for people who are on their own personal heart journeys. And this is what tonight is about. It's been quite a journey the last 18 months with the COVID-19 pandemic. Many of us have seen our lives disrupted in a lot of ways. Distance from family, friends, and even healthcare has become an unfortunate reality. So we are hoping tonight to have a conversation with you, a heart-to-heart, about your most important organ, your heart. Are you or a family member at risk for or have experienced a heart attack or stroke? Is cardiovascular disease preventable? And what are best practices for keeping your heart healthy? We'll answer some of these questions and your own questions as well throughout the hour. So tonight we have two conversations and opportunities for your questions. Our first conversation will be with one of our favorite cardiologists, Dr. Anne-Marie Navar. Dr. Navar is a cardiologist and epidemiologist at University of Texas Southwestern Medical Center, focusing on cardiovascular disease prevention. Joining Dr. Navar will be a fellow Texan and heart patient, Lee Parker. Lee underwent open heart surgery in 2016. Her family has a history of heart disease, and both her father and grandfather had a heart attack or stroke. Lee thanks good care for keeping her 80-year-old father healthy today. Everyone watching us live this evening should please feel free to ask questions in our question and answer box on your screen. We will do our very best to incorporate the questions in our discussions. So with that, I'd like to welcome Dr. Navar. Hi, Dr. Navar. So glad to have you join us. We never get tired of working with you. You've been on many of our webinars.
Hi, Jasmine. It's great to be here.
So PATCH has organized this webinar as a source of information for people with or at risk of heart disease. We want to make sure people leave this webinar having a strong understanding of cardiovascular disease, its risk factors, and how it should be managed. So let's start with the basics, as we like to say, the 101 questions first. So what is heart disease? What causes it? And what are the telltale signs or risk factors, as we call them?
So for the purposes of the conversation tonight, we're going to talk about a specific kind of heart disease, but we'll use the term heart disease for short. So technically speaking, heart disease includes a whole lot of things, including electrical disorders of the heart, valve problems, heart failure where the heart doesn't pump. But for tonight, we're going to use heart disease to really refer to coronary artery disease, which is a process of depositing cholesterol in the walls of the arteries that creates blockages over time. And sometimes those blockages can break off and cause blood clots, which is what we think about as a heart attack. So tonight, talking about heart disease, we're specifically talking about disease of the coronary arteries.
Great, thank you, Dr. Navar. So how is heart disease prevented? And specifically, at what age range should you even be thinking about heart disease prevention?
Well, the good news is it's never too early and it's never too late to think about heart disease prevention. Even in people who've had multiple heart attacks, there's a lot of things that we can do to prevent future events. But it's also never too early. So things that we do early in life really impact our risk of heart disease in the future. We know from studies of autopsies of very young people that we start getting cholesterol deposits in the artery walls in our teens and 20s. So early on, we need to think about having a good lifestyle, staying active, exercising, not smoking, and not becoming overweight or obese. And then as we get older, we also need to be paying attention to things like our blood pressure and our cholesterol levels. So we do recommend starting getting screened for your blood pressure and cholesterol in your teenage years, and then regularly as you become an adult to make sure that those risk factors stay under control Now, if you do all of those things, live a heart healthy lifestyle, avoid smoking, keep your risk factors under control, you can reduce, but not eliminate, your risk of getting coronary or heart disease.
Great. So, does heart disease impact males and females differently? Is one group at greater risk than the other?
So the short answer is yes and no. The the epidemiology of heart disease is such that probably because of the effects of hormones, women tend to get heart disease and their first heart attack about 10 years later than men do. But if you look over the course of our lifetime, women are as actually at high risk of heart disease as men are. It just comes on a little bit later. Some of the symptoms of heart disease in women can be more subtle. So, women are slightly more likely than men to have sort of atypical chest pain on the wrong side of the chest, or chest pain that sort of goes in funny directions, or maybe even not have symptoms of heart disease. Women are also more likely to have a type of coronary disease that affects the tiny little branches of our blood vessels and not the main arteries. But across the broad spectrum of people, for men and women, the reality is that most men and women present very similarly with a heart attack, and we discover their heart disease very similarly as well. We also know that all of the treatments that we recommend for prevention of cardiac disease are similar and work the same in men and women.
So, would you say that by the time symptoms develop, prevention is too late?
No, I would say that by the time symptoms develop, prevention is even more important. So we want to start early and we want to do everything we can to prevent heart disease from happening. But even once you have symptoms for heart disease, there's a lot of things that we can do to lower your risk of that turning into a heart attack or a complication of heart disease or other atherosclerotic disease like a stroke. So, if you're starting to have symptoms of heart disease, there's actually a number of things that we can do to make you symptom free that don't involve surgery or procedures. And we do other things like lower your cholesterol, control your blood pressure. If you have diabetes, get your blood pressure under control. And all of those things can prevent the downstream consequences of blockages in the arteries, namely the heart attack. So, the symptoms that we talk about when somebody is becoming symptomatic from heart blockages are a result of the cholesterol plaques in our artery walls growing to a point where they're starting to impede the blood flow. So the heart, with exercise or when the heart is stressed, isn't getting all the blood flow it needs because there's a blockage there. That's sort of a warning sign like, man, there's a blockage and it's big enough to cause problems. Um, the real worry is not that those problems are going to get worse, which is an issue, but that blockage can become unstable, can break off, and you go from having a 60 or 70% blockage to 100% blockage, and that's what a heart attack is. So if you get to the point where you're symptomatic, we as cardiologists will do two things. We'll first try to get you asymptomatic, either with medications or if that doesn't work, with things like surgery or stents. But also, we'll start you on a series of medications to help stabilize that plaque and keep it from turning into a heart attack.
Got it. Okay. So I just had to just hop off video for a second. My feed is slow. Perfect timing for my feed to be slow. So I'm just going to continue with the questions for now. What would you say is an ideal heart healthy diet? So we in the cardiovascular community hear so many things: keto, vegan, Mediterranean, vegetarian. They're all kind of thrown our way. And I'm sure for somebody who is a new heart disease patient, somebody who's just learning about heart disease, they might be confused. So what is your opinion?
It's really hard to know what the perfect diet is. And part of the challenge is that it's easy to do a study of a medication. I can give 10,000 people one medication and 10,000 people another and compare outcomes for those groups of people and be able to say, this is the medicine that you need because it worked better. It's almost impossible to randomize somebody to a diet. And so it makes it really challenging to compare head to head one diet versus another. Because the literature on diet is a little bit fuzzy, what I like to tell patients is to find a heart healthy diet that works best for you. For some people, that may be a largely plant based diet. For others, it might be more of a Mediterranean diet. The difference between the two is pretty subtle. Both have a lot of things in common: high amounts of fruits and vegetables, whole grains, lean meats and fish if you're going the Mediterranean route, and things like nuts and olive oil. The other thing that we know is that while we don't know exactly which diet is best, we do know certain foods are not good for you. So, minimizing the amount of added sugars and refined sugars in your diet, avoiding trans fats and saturated fats are a cornerstone of good heart health. Now, there's two other diets that people are talking about a lot lately. One is the keto diet. We don't have good data on the long-term safety or benefit of the keto diet. I have seen a number of patients who really struggle to lose weight be able to get weight off with the keto diet. It is a challenge because the keto diet does cause some significant changes in your cholesterol and your cholesterol particles. So if you're going to undertake a keto diet, find a cardiologist or your primary care doctor who can keep an eye on your cholesterol levels and other things as you're going through. The other diet that some people do is what we call intermittent fasting or time restricted eating. And this is really a way largely to restrict your caloric intake. If you're only eating a certain amount of time, you just don't eat as much. Again, that works really well for some people, particularly people who are wanting to lose weight. Uh, what I would tell people is for a heart healthy diet, focus on eating more of the good stuff and less of the bad stuff. If you're doing a diet to lose weight, find a diet that's going to work for you and work for your lifestyle and your schedule and one that you can stick with long term.
That's great, great advice. So, I'm just going to bounce off the last question. For someone who is seeking answers online and they're experiencing any heart-related symptoms, was just diagnosed with a heart condition or suffered a heart attack, they're forced to live with this new reality. And oftentimes, the first thing they do is they go on Google and look up what they should be doing. And Google, it can be a wonderful source of information, but also a dangerous source of misinformation. So, who are the trusted resources a patient can and should rely on?
So I think it's unreasonable for us to think that patients and people aren't going to look up their medical conditions. I do it for things I don't know about when I get a new diagnosis or a family member calls me with a new problem. What can be really helpful when you're looking at things online is to know what are trusted sources. So, as a cardiologist, the two sources that I like the best for information about heart disease are the American Heart Association and the American College of Cardiology. Almost every cardiologist is a member of one of these two societies. And these are the societies that write the guidelines that we practice by that summarize all of the relevant clinical trial data. They both have really good patient facing information on their websites. The ACC's website is called CardioSmart, and the AHA's website, you can go to heart.org. So both of those are really good. Now, you may feel like you need more information beyond what's on those two websites, and certainly going to Google and searching your condition is one way to find that. I would just recommend to any of you that's looking up additional information about your condition or your medications is look at the source of the site. What is the source? Is it a medical person? Is this background with significant amount of experience in science? And generally speaking, organizational websites have a lot more vetting than an individual doctor who can just put an MD after their name and put up a website with whatever on it. The other thing I would say is look at the motivation of whatever the site is that you're reading. If the site has an online store where they're trying to sell you a bunch of supplements or a subscription to a diet plan or books or a newsletter, I worry a little bit that often the information they're giving you is being placed to try to get you to buy something or change your behavior in a way that might be good for them. So, bottom line, start with the American Heart Association at heart.org, American College of Cardiology at CardioSmart. And then after that, look for sites that come from health systems, places like the Mayo Clinic, the Cleveland Clinic, all have really good patient facing information.
Great, thank you. We actually have a question from the audience, so I will ask this to you. The question is, I've struggled with cholesterol since my late 40s, and I'm wondering what I need to do for my teenage son to ensure he doesn't have to deal with cardiovascular disease himself.
So my heart goes out to you for the way you frame the question. And one thing I want to point out is that often when people have high cholesterol and use the word struggle, the implication is that there's something that you could have done differently to get your cholesterol under control. Most people's cholesterol isn't determined by what they eat or how much they exercise or what they do. It's determined by your genetics and how much cholesterol your liver makes and how much cholesterol your liver holds onto. So, for a lot of people, even those having a perfect, healthy lifestyle, eating everything right, exercising all the time, you'll still have high cholesterol. And in those cases, you can't go back and pick new parents. So this is the case where we're really fortunate to have a number of medication therapies that can work alongside your diet and exercise to lower your cholesterol and lower your long-term risk of heart disease. Now, there are some people who have LDL cholesterol that are so high that we start to think about specific conditions that run in family called familial hypercholesterolemia. So for people who've ever had an LDL cholesterol over 190, this is the group that we start thinking about doing genetic testing or going to a specific lipid clinic to see if you have the type of high cholesterol that runs in families that's extremely high called FH. In those cases, there's other treatments that we can use to control your cholesterol. And it also puts you at slightly higher risk of heart disease than somebody whose cholesterol is elevated without that genetic problem, in which case we're a little bit more aggressive in how we other treatments that we'll offer. Now, you asked about your son, and this is a great point. So anybody who's on the webinar has an opportunity to really affect the health of their family members. Everybody needs to have their cholesterol checked. We recommend adults get it checked about once every 5 years or more frequently if you've had changes in weight or changes in your lifestyle. So if you have high cholesterol early in life, you can get on medication, lower your cholesterol, and lower your risk of heart disease. Other times, you can make changes in your diet or your exercise habits to get your cholesterol to a safer zone. So, if you have high cholesterol and your son also has high cholesterol, it makes me think that you might have the type of high cholesterol that runs in families. And I just want to maybe reframe the question. Instead of saying that you struggle with cholesterol, I would say that cholesterol is really bothering you because it's not anything that you're doing wrong. I think the fact that you recognize that you have high cholesterol, you've had it checked, and you're asking about it's the first step. The next step for you would be either medication therapy if it's high enough, or keeping an eye on it in case it goes up over time, and then making sure your son has his cholesterol checked and gets to the right specialist if it's high. And in pediatrics, I don't know the age of your son, that could sometimes involve cardiology, but other people that manage cholesterol in young people include endocrinologists or hormone specialists. And they can look at the cholesterol, they can run other tests to see if there's other problems with metabolism that may be affecting it. And if needed, they can start and then monitor treatment.
Okay, so there's another question that may be relevant to this question. Would you say exercise or diet is more important for heart health?
Well, that's not really a fair question because the answer is both. They work very much together. And you can't eat poorly if you exercise, and you can't not exercise if you eat well. They're both pretty additive. So I think it's almost impossible to say one is better than the other. I think it's for individual people, some folks already eat pretty healthy but don't exercise at all. In that case, exercise is going to make the bigger bang for the buck because you have more room for improvement. Now, on the other hand, if you eat really poorly but exercise all the time, well, then changing your exercise isn't going to really affect your risk, but you do want to change your diet to help improve your risk long term. The other thing I'll point out is that diet and exercise don't only prevent heart disease, they prevent dementia and they prevent cancer. So, live longer and prevent all sorts of diseases with basic changes to what you eat and what you do.
Great. Thank you, Dr. Navar. So earlier you mentioned stents. I want to talk about this for a second. They're a common procedure used to clear blockages in the arteries. Obviously, these blockages are what causes cardiovascular symptoms, pain in the chest, et cetera, shortness of breath. So is there a limit to how many stents that can be placed inside a body? And does that mean that stents are a cure for heart disease, or is there still risk for having another heart event?
So theoretically, there's no limit to the number of stents you can have placed. But once you've had a stent, that stent can get a new blockage over time. And every time you put another stent inside of an old stent, the risk of complication goes up. So we try to avoid putting in stents whenever possible. Stents are really good at keeping people alive longer and preventing heart attacks when somebody shows up to the hospital with a heart attack. So if you have a cholesterol plaque, breaks off, you get a blood clot in the artery, and it's totally occluded. Putting a stent in can restore blood flow, can help your heart survive, can prevent complications of a heart attack, and help you live longer. So stents are essentially kind of the immediate urgent treatment for a heart attack or myocardial infarction. Stents are not a cure for heart disease, though, because when we put a stent in, we're putting a stent only in that area that's fully blocked off. But in somebody with heart disease, they likely have cholesterol plaques and blockages all throughout their coronary artery tree. And so, what we need to do is consider stents sort of an urgent treatment for the heart attack, but then medications are what we use to keep all of those other plaques in the other parts of the arteries from turning into heart attacks or from breaking off over time. So, stents are a heart attack treatment. Now, the other group that can benefit from stents are when somebody has a blockage in a coronary artery that's causing them a lot of symptoms, where they're short of breath or they have chest pain going up the stairs or they can't exercise. And in those folks, we always will start with medications and try to get them to not have symptoms with medications alone. But in people who we can't get free of symptoms on medications, putting a stent in can improve quality of life and help you feel better. But a stent alone does not lower your risk of heart attack. In fact, it's the medications that you get along with the stent that are preventing the heart attacks. The stent in this case is just a symptom relief.
Okay, I'm back on video. So this my next question for you is, can I manage my heart disease without medication? Can I still live a long life? Obviously, you indicated the answer to that is you should be on medication depending on your risk. So please go ahead and expand on that.
Everybody's going to die of something. So, no medication that we give anybody is going to keep you alive forever. What we're trying to do when we recommend medication for somebody with heart disease is help them live longer, but also help them live better. So, if we can prevent a heart attack that might lower your heart function and turn into heart failure down the road, that means you may have many more years of really active, healthy, symptom free life. If we can prevent a stroke by lowering your cholesterol and keeping your blood pressure controlled, then that may be many more years of having full functionality and full ability in your life. Even if it doesn't help you live longer, it will likely help you live better. So, all of these medications together, we do know, especially in people who have heart disease, help people live longer and help people live better. But most of them are optional. And for some people, taking a medication every day is not their choice. And many of those people can live years with heart disease without having more heart attacks. It's just that if we look on average, people who do take all of the medications that we generally give for heart disease will live longer and will live better. I think if you look at the statistics over time, our ability to keep people alive after a heart attack has increased dramatically. It used to be that many people died of their first heart attack, and those who survived really early on had a lot of complications. Now, most of us know somebody who's had a heart attack, may have been in the hospital for a few days, but now is back to work and doing great and living their life. So, our goal with the medications is to try to make as many people who have heart attacks into that sort of survivor story where they're able to spend the life with the ones they love and do the things that they love to do. But it is a choice for people to take medications or not. And in that case, I think it's important to talk to your doctor. There may be one or two medications that you benefit more than others from, or maybe there's a medication that you struggle with in terms of side effects or affordability. We're often able to be a little bit flexible in the medications that we recommend in those situations. The one caveat is in people who have had a stent in their arteries. It is really important to take the medications that we prescribe that block blood clots for the amount of time that your doctor tells you, usually a year after you get a stent. Because after you have a brand new stent in your artery, it's sort of a foreign material, and your body can often develop clots in that stent. So You actually can cause more problems with a stent if you put it in somebody who does not want to take any medication. So if you're not somebody who wants to take medication ever, don't get a stent because you're likely to cause more problems than good.
So, what's your opinion on some of these natural supplements that you can buy over the counter that claim to reduce LDL cholesterol, the nutraceuticals?
I really struggle, frankly, with the nutraceuticals because I think that the advertising around them often implies a lot of benefit that just is not there. So the FDA regulates supplements like food. You don't have to prove that they lower the risk of heart attack or stroke in order to put on the label that it's heart healthy or promotes heart health or lowers cholesterol. None of the supplements that you can buy in the supplement aisle, including fish oil, have ever been shown to lower somebody's risk of heart attack and stroke. Furthermore, the supplements are often contaminated with things like heavy metals or other impurities that can actually make your health worse. There's not the same level of regulation around production and processing for supplements as we have for over the counter medications or the prescription medications that we prescribe. There's one supplement that I've heard a lot of people that would like to take instead of a statin. That supplement's called red yeast rice extract. Now, the interesting thing about this is that the active ingredient in red yeast rice extract is actually lovastatin, which is a prescription statin that we can write a prescription for and have covered by insurance. So when somebody comes to me and says, "Well, I don't want to take a statin, I want to take red yeast rice extract," I often will recommend maybe using lovastatin instead, because what you're getting is really the purified single ingredient in red yeast rice extract without all of the other things that might come in terms of impurities. Supplements are often really expensive. We don't know how well or not they interact with other medications that we're prescribing. And again, they haven't been shown to lower the risk of heart attack or stroke, and we don't know about their safety. All of the medications that we recommend that are prescription for cardiovascular disease, things like aspirin, blood pressure medications, antiplatelet medications, cholesterol medicines like statins, these have all been studied in tens of thousands of people where we compare them to a placebo. So we know exactly how well they work in terms of lowering your risk of heart attack and stroke and death. And we know a whole lot about their safety and what we can expect and not expect. That is just not true for nutraceuticals and supplements.
Thank you. So, a couple more questions for you, Dr. Navar. What should a patient do if they're having issues getting their insurance company to pay for the medications they're prescribed? So, are there assistance programs, or should they perhaps consult with a physician who specializes in navigating insurance issues?
It's a great question. My first recommendation is go to goodrx.org, goodrx.org. Unfortunately, our healthcare system is super complicated, and in the same town, you can get 3 to 4 fold differences in the prices for the medications that you're being prescribed. So if you don't have insurance, or even if you have insurance and your copays are high, sometimes the out-of-pocket costs on GoodRx are much lower. And it'll show you what the price of your medication is and what the price is at different pharmacies. So you can shop around to different pharmacies in your area. If you're getting a prescription medication that's a brand name or one that's not available generic, there are often patient assistance programs through the companies that you can go through, and you can usually just Google patient assistance program and then blank the name of your medication, and you can find it. The third is oftentimes it's hard to get medications approved by your insurance company. And here, my best advice is to be persistent. And if you can't get a medication approved or your doctor isn't able to get a medication approved, find another doctor who may be able to be more persistent as well. It often takes us a couple of appeals to get some of these higher priced medications approved for treatment. But often after 1 or 2 appeals or a phone call with the insurance company, I'm able to get coverage for many of my patients. Then the final piece is if you have commercial insurance, so doesn't work if Medicare or Medicaid, but if you have commercial insurance, most companies that make brand name medications have a copay assistance program where you can get a copay card to give to your pharmacy and it'll cover whatever your out-of-pocket cost is. So your insurance may cover it, but want to charge you 50 or 75 bucks as a copay. This is a good way to help. And then the final piece, and I know this is a long answer, is Talk to your doctor about the cost of your medications. Often I'm struck to find that some of the medication prices that my patients are paying are way higher than expected, and I can switch them to an alternative that's much cheaper without compromising their health or safety. But we can't know that there's a problem with the cost of drugs for you if you don't tell us. So please let us know. We know this is something that you're dealing with, and we're happy to help.
Thanks, Dr. Navar. Great response. So final question, and I'm actually going to take it from the audience. I'm on a statin and have tried different ones, but still can't get my LDL lower than 100. Any recommendations that you haven't already mentioned so far?
Well, first, it's good for you for sticking with the statin. It can be really frustrating when you're not seeing the results that you want to see. So the strongest potency statins that we have are 40 milligrams of rosuvastatin or 80 milligrams of atorvastatin. So the first thing you want to do is make sure you're on one of those two. There's a bunch of new therapies that we have available to add on to your statin if your LDL cholesterol remains high. The first is a pretty cheap one. It's called ezetimibe. It's a pill. That would be sort of the first line, but it may not get you as far as you want your cholesterol to be. If you have heart disease or heart blockages, you want your cholesterol down into the 50s. In that case, you may need more than just a statin and ezetimibe. And we have a couple of approved therapies. There's an injection therapy called a PCSK9 inhibitor, which is an every 2-week injection that can dramatically lower your LDL cholesterol. And there's a new therapy that just came out that is in addition to ezetimibe called bempedoic acid, which is another pill that many people are eligible for. So you're already doing the right thing, which is recognizing that 100 is still probably high, especially if you've had high cholesterol for a long time. You really want your cholesterol to be, your LDL cholesterol to be lower than that. And especially if you have heart disease or at risk for heart disease, you want it less than 70. So in that case, talk to your doctor about add-on therapies or find a preventive cardiologist or somebody interested in cardiovascular disease prevention to get their opinion on what additional therapies you may consider.
Thank you, Dr. Navar. I could go on for hours with you because this is very interesting, but unfortunately we're out of time. So with that, I'm going to introduce my colleague, Ryan, who's going to have an interview with Lee Parker. Thank you, Dr. Navar.
Thank you. And thanks to the audience for some really wonderful questions.
Thanks, Dr. Navar. Thanks, Jasmine. And hello, everyone. Again, my name is Ryan Googe, and I'm the Executive Director for the Partnership to Advance Cardiovascular Health. And I have with me a great patient and someone that we are very fond of, Lee Parker. Lee, so great to see you. How are you?
I'm doing great, Ryan. Thanks. Nice to be here.
Isn't it so amazing to listen to Dr. Navar? She puts stuff, so simply, like this really complicated stuff, but just like in such, simple terms to understand. It's such a pleasure, honestly, to listen to someone like that.
Yeah, I consider myself a fairly informed heart patient, yet I learned something. So thank you, Dr. Navar.
That's great. That's great. So for everyone watching tonight, we actually have this great video of Lee up on our website, advancedcardiohealth.org, where she talks about her struggle with heart disease. And I just want to say, before we even get started, you're going to see I'm enthusiastic about having Lee here. And I'm not just saying this because she's here tonight, but Lee is one of the best patients and patient advocates that I've ever spoken to. Lee, honestly, you're an inspiration because you have just the best attitude about fighting for yourself, and despite this additional challenge of dealing with a heart condition. So it's a real pleasure to have you here, and I'm really so happy that you could join us, and thank you so much.
Thank you.
I just think it's super important for people to hear from someone going through this. You're living the struggle, you're dealing with this condition on a daily basis, and there's just something so much more real about talking to someone who's dealing with life, and dealing with health stuff. So again, thank you for sharing your story with everyone that's on the webinar tonight. So, but, let's talk about the fun stuff first. Tell us about, the stuff that has nothing to do with your heart. Name, where you're from, what you do for a living, kids, grandkids, all that kind of stuff.
Yeah, sure. My name is Lee Parker. I live in a suburb outside of Houston. And I am a wife and a mom of 2 grown daughters, and I have 2 beautiful grandchildren. I work full time and I spend a good deal of time doing volunteer work as well.
So, part of that volunteer work I know is working with an organization called Mended Hearts, which anyone on the line, I would encourage you to check out that organization. It's the nation's largest peer-to-peer patient support community, or heart patient community. And one of Mended Heart's kind of signature things that they do is that they go into hospitals. This was back when you could go into hospitals, and they would meet with folks who have had open heart surgery, which is a major and traumatic thing to go through. And a lot of times people join Mended Hearts after they've met with a Mended Hearts volunteer because they've been visited by an angel, basically, in the hospital. So Lee, give us a little overview of your heart journey and
Sure.
how you became a Mended Hearts volunteer.
Well, as Jasmine mentioned in the beginning, I have a family history of heart disease. My dad had a stroke at age 59. He had a heart attack uh, 10, 15 years later. I'm thankful to say he's still with us. He's going to be 81 this Saturday, but he does live with heart failure. And I think Jasmine also mentioned my grandfather also had heart disease. So knowing my family history, when I was about 40 years old, I thought that it was a good idea to go get just a regular routine physical, kind of baseline, see where I am. Didn't expect to find anything. Thankfully, I went to the doctor because my primary care physician heard a heart murmur. And that heart murmur led me to obviously a cardiologist. I won't bore everyone with the details of my tests and all the things that they did to come up with my diagnosis, but I was eventually diagnosed with aortic stenosis at age 40, which is a narrowing or tightening of the aortic valve. And we weren't 100% sure why that was happening to me at such a young age. It's not common until you get a lot older. But they suspected that it was a congenital condition, meaning that I was born with it. But right then I knew I needed to, because I had this other complication. I had family history, and now I have potentially a congenital heart defect. I really needed to make some lifestyle changes. So I did. And I fortunately did not blow it off. And I went to see my cardiologist every 6 months and would have an echocardiogram and a stress test. And I lived with my stenosis up until a certain point. And like so many things, it just got worse a little bit over time. After about 12 years, I went to what I thought was going to be a somewhat routine cardiology visit. And I heard the magic words. And those magic words were, "My dear, it's time for your heart surgery." And while I knew this was always a possibility, it's not the words that you ever really want to hear. But here I was faced with having open heart surgery. It really wasn't a decision for me because I had learned enough about valve disease and I knew my family history and the risks. And to be honest, the risks of not having surgery were that I probably wouldn't live another year if I didn't have the surgery. So while it was daunting and overwhelming and scary, I knew that it was the step I had to take. So I had open heart surgery on February 3rd, 2016. The surgeon replaced my aortic valve with a bioprosthetic valve. And I got what I term a bonus. I had an aortic aneurysm repair. It's common with the type of heart defect that I had, or I have, to have an aneurysm because the valve's not working right. And so your aorta kind of balloons up like a hose. And so that I had an aneurysm repair as well. After my surgery, I was very fortunate that my surgery went well. But I wanted to give myself every chance of doing well. I had a brand new heart valve. I wanted to be well taken care of. and my cholesterol was high. I started on a beta blocker to manage the rhythm of my heart, but I also had slightly elevated cholesterol. And so I started taking cholesterol medication right after my surgery as well. I just
Lee,
wanted to do everything I could to create the right environment for a healthy heart.
Lee, can I ask you, because I hear your story, and you were dealing with heart complications for a long time, and then you realize that you have to have the surgery, and then afterwards you've got you're talking about you're on different medications, and how, like, where do you find the wherewithal to like stick with it? Like, where does that come from?
I'm going to be honest with you, Ryan. It didn't come from the beginning. And for people that are listening that maybe have a recent diagnosis, I mean, at first I was in denial. I really, I didn't feel badly. I mean, this was a heart defect I'd had since birth. So it didn't affect how I felt at all. So I thought, are we sure? I mean, I really just think I was in a bit of denial in the beginning, but I didn't ignore it, thankfully. And I continued to learn about it. And the more I educated myself about heart disease and heart defects, and just the options for treatments and things like that, the more I learned, the more empowered I felt, and the more in control I felt. Because when you have heart disease, first your very first reaction is after denial is, what am I going to do now? And by educating myself and learning what I could, it gave me some sense. I mean, these were the cards I was dealt with. So, how am I going to play them? And the best way for me to do that was to just learn as much as I could, to ask a lot of questions, to build a relationship. Because at first I didn't really trust my cardiologist. I thought, oh, this not right. And over time, I learned to ask the right questions. I started to read and understand what was going on in my body, and I built a relationship with him. So when 12 years later, yeah, it took 12 years, but 12 years later, when he said, it's time for us to open up your chest, I didn't even go for a second opinion. I had learned to trust him, and I knew all along, because of the multiple visits and the conversations and the trust I had built, that he referred even the right surgeon for me. He knew my personality. He knew that I was a researcher. He knew that I would come armed with a bunch of questions. And so he found the right surgeon that was not only brilliant, but would be the right match for me as a patient. So I felt very fortunate that I had built that relationship, and I was sent to a surgeon that didn't have any trouble answering my million zillion questions about open heart surgery.
I have to imagine too, Lee, that being facing such a complicated heart condition, family history, all this stuff, and then that's got to be overwhelming and scary. And especially at first, you got to think to yourself, I don't really know what's going on with my body to a certain extent. I think getting to yourself to a place where you're like, I'm going to take control of this has got to be, like you said, incredibly empowering. My question is, I guess, was there a moment that you can remember where you were like, okay, like, I've got this, I'm going to do this, I can do this?
Yeah, I would say there's kind of several moments through your heart journey. Heart journey is not a linear thing. It's an up and down little thing. And you take two steps forward, one step back. So, but I would say that when it was time for my surgery, so during my surgery, the preparation, the recovery of my surgery, I remember distinctly. I was very fortunate. I had surgery. I wasn't in the hospital very long. My strategy was to do whatever the doctor said, and so that I could go home as fast as possible. And so, part of that is getting up to walk first thing right after your open heart surgery, and to continue the breathing exercises, take the medications. It was challenging for me to eat, but I did, because I knew that I needed to gain my strength back. But when I got home, I realized that was really almost a scarier moment, because when I got home from the hospital, here I was with a new heart valve. When you're in the hospital, they're monitoring every heartbeat, and I was tethered to somebody who knew I was doing okay. And when I got home, it was even a little bit scarier. I had trouble going to sleep for fear that I wouldn't wake up. I had a lot of anxiety after my heart surgery, but I kept walking. And I honestly, to this day, think walking saved my life.
Mm.
So I would go out every day and continue to walk in an effort to continue to get back to normal, whatever that is. But I remember distinctly one day I was out for my daily walk, and it hit me that this last phase, the phase of home recovery, really isn't the last phase. I mean, this is a lifelong thing. I'm going to be a heart patient for the rest of my life. I still need to go to a cardiologist, even though my surgery was, 5+ years ago. I'm always going to have to follow up with my surgeon. There's a chance, a really good chance, that I'm going to need another heart valve at some point. I have to continue to do all those heart healthy things, taking care of my eating habits, my exercise. So I just, when you think back to that one day where I was like, you know what, this is not a one-time thing. It's a lifelong endeavor. And I just realized, and that's when I started to accept it. And that's when I started to realize that I could either continue to worry about it or feel sorry for myself, or I could take control in whatever way I could. Like I said, these are my cards. How am I going to play them? And the take control over the pieces that you have control over, educate yourself. And I just realized I had to embrace the fact that I was going to be a heart patient for my whole life.
Well, and I've heard you talk about before, you're going to create the best conditions for, in your body for your heart. So tell me about, working so hard to protect, that vital organ. Like, what do you do on like a weekly, monthly basis, to prevent
So
anything else happening?
yeah, and I think that life is worth living. So I don't think for heart patients out there, don't expect to be perfect. If you think I don't have birthday cake on my granddaughter's birthday, I make it and I eat it. But I also want to live a really active life, so I have to make some choices. I have actually been a vegetarian for over 20 years, even before I knew I had a heart condition. And so I've always been a healthy eater, but just because I'm a healthy eater and I walk every day doesn't mean I don't have issues with my weight a bit. I constantly have to watch that. I'm a really good cook. So even though I'm eating healthy food, I'm a good cook. And so I have to watch, what I'm eating. And I exercise every single day, but I could do some things better. I probably need to do some strength training. I would love to get into yoga and things like that. But life is busy. But I want to live an active life. And so I have to make some time. And that's why I made the commitment to myself. Even though I may not do everything on my list that I think is good for heart health, I've made a commitment to myself that I'm going to walk every single day. So no matter how busy my work schedule is, no matter what's going on, whether it's a hurricane or a freeze in Houston, I get out there and I walk. It may not be very long, but I want to make that commitment to myself. So I just do the very best I can. I think, Ryan, you and I've had this conversation that I struggle with statin intolerance. And so I have high cholesterol and I have difficulty taking statins. I've actually applied for the new medication that Dr. Navarro mentioned, the bempedoic acid, and my insurance declined it. That doesn't mean I'm going to give up. I have a appointment with my cardiologist next Monday. So we're going to talk about it again. Okay, what's the next thing that we try? So my advice to people is don't just take the first face value answer. Keep looking for the right thing for you. And everybody's different. And how your body, you're the expert on your body. The doctor may be an expert in their field. The doctor may understand cardiology better than you do, but you know what you feel like, and when things feel right or when they don't. And it's your job to communicate that to your doctor. It's your job to find a doctor that you can have that kind of relationship with, so you can ask all the right questions and expect them to give you a response that's understandable for you.
So let's dive a little bit more into that, your relationship with your doctor, because I think the way you approach it is really interesting. So I think one thing I can say about you is that you're an advocate for yourself. You definitely advocate for yourself and for your heart, and you take your heart health very seriously, and you work your doctors over, at least from what I can tell from our conversations, to make sure that you're getting what you need. So, tell us a little bit about, your approach. Because I think,
Well,
it can
I also give back to them. So, my congenital heart specialist leads the adult congenital heart program at Houston Methodist. And, when he asked me to be on the patient family advisory committee, I said, I'll do anything for you because you do so much for me. So it's a give and take. It's a relationship I've built. The cardiologist that I saw for 12 years before my surgery actually retired. And, and then I was referred to a different doctor in the same practice. And, I have a very thick file. So I really wanted to stay within the practice. And I'm sure she was a brilliant doctor, but she just didn't have the right personality match for me. And I just felt like she was a little abrupt with her communication with me. And as you can tell, I like to talk and I like to really understand. So I just went and asked for a different doctor in the same practice. And when I talked to them about what I was looking for, they made another recommendation, and I love my new cardiologist. So it's a matter of, people talk about second opinion as it relates to the medical thing, but you really have to have a relationship. I have a fantastic relationship with my primary care physician. And I think that all heart patients need to have a strong relationship with their primary care physician who understands that they're a heart patient, and knows enough about your overall health to help direct you. They're kind of the central point. So I think having a strong primary care is important, but also your cardiologists and your specialists need to be someone that you can build a relationship and that you can build trust with. So when that you do need to have a procedure, it doesn't even have to be necessarily open heart surgery, but when you need a procedure, you want to know that the information they're giving you is something you trust.
So Lee, I want to ask a question that we've got in the chat here about, family dynamics. And I'm curious, is it like a family affair? Like, how do you, does everyone in the family support you in your hard journey and that kind of thing? Do folks encourage you?
100%, 100%. I tease people because when I went for my open heart surgery, I had so many people in the audience or in the waiting room that I said, I hope no one else have an open heart surgery because there's no room for their family to sit down, because my whole family came. I mean, I had family come from out of state to sit there for a 5-hour surgery. So I feel very blessed that I had such a strong family unit. But, I also look out for my family because, when you're born with congenital heart disease, that means your siblings could have it. I had to have my daughter tested. I was thankful that she didn't have a congenital heart defect, but, the doctor pretty much came back and said, you don't have what your mom has, but that doesn't mean you don't have to take care of your heart. And you still have to watch your cholesterol and eat right and exercise and all of that. And, I think that it is a family situation because it runs in my family. And I'm the only one with a congenital heart defect, thankfully. But, heart disease in general runs in my family. And so, yeah, my father having heart failure, I send him brochures and things from Mended Hearts, and we look out for one another.
Absolutely. So, you mentioned at the top, Lee, as we start to close out here, that you work full time. You obviously have a busy life, busy family life. It sounds like, why give up time to do, webinars like this and work with Mended Hearts and that kind of thing?
So right after my surgery, the short answer is because someone did it for me. After my surgery, there was a lady from Mended Hearts that came into my room, stood at the end of my bed, and shared with me her story of having bypass surgery. And I remember lying in bed with a big bandage on my chest and looking at this woman and thinking, if she can do it, I can do it. So she gave me hope. And I knew right then and there that I wanted to do the same thing for others. So, once I got well, I found my way to a Mended Hearts meeting. I met the lady that saw me in the hospital, and she's a dear friend now. And so, when you set out to volunteer, you set out to give back. But what you don't realize is how much comes back to you, and and it's just an inordinate amount of reward. It's a job. It's on top of my job, but it's a job that gives me such great rewards. I would like, Dr. Navarro gave some references, and I would like to encourage people to go to mendedhearts.org. We have a lot of webinars, educational materials, a way to connect with other heart patients. And I would like for people in the audience to know that that is a very trusted resource and that there's great information on our website.
So I've got 2 questions for you. One that just came in the Q&A, and then one final one that I have for you. But the first one's pretty simple, but I think it's a good one. How do you stay so positive?
I think when I first was diagnosed with heart disease, I was a workaholic. I was a single mom at the time, and I really didn't have time for heart disease. And so I really don't think I was the best patient in the beginning, but it's a journey. And as you learn more about it and as you connect with, I think the American Heart Association latest numbers are like 85 million people have heart disease. So when you realize you're not the only one out there, you realize that you need to, it's just the hand you were dealt. Everybody has different things that they have to deal with. And I can sit around and wonder, why was I born with a heart defect? And why am I born to this family that has, cardiovascular disease? Or I can say, you know what, that's the family I have. They're pretty amazing. And so let's see how I can make the most of it. But I honestly say I didn't start off that way. It's just been, through the journey, and as you learn and as you start to accept that you're a heart patient for life and you embrace it as part of who you are, open heart surgery completely changed my priorities, completely made me realize what's important in life. And I try to put my focus on the things that matter most.
Great. That's super. That's fantastically. Let me just one last question here, and I think it's you've given me, and I'm sure everyone else that's watching, a ton of great advice. Not only just about for someone that's dealing with heart disease, but life advice generally, honestly. But I'm curious, like, if there was if you could like reach through the screen and grab someone and give them one piece of advice, who's really navigating their hard journey right now, like, what's the best piece of advice you'd give that person?
You're not alone. There are a lot of people out there walking a similar path to you. Find them, connect with them, and also educate yourself. Find out the information about your particular heart disease, what you have control over and what you don't have control over, and the areas where you do have some control, use that. Find doctors that you can have conversations with and that you can build a relationship with, because once you become a heart patient, you're going to be a heart patient. A lot of things will be corrected, or you may improve, or it may be a situation where you're just managing a chronic condition. Whatever it is, you have to just take one day at a time and do what you can to provide yourself with the fullest, most active life that you can.
Absolutely. Well, Lee, thanks so much. I think everyone now knows why we love you so much, and we're so appreciative for your partnership, and grateful for Mended Hearts for allowing them to lend you to us. So thank you so much for joining us for this heart-to-heart discussion, and I'm sure it won't be the last one that we do together. So thank you.
Okay, great to see you again. Thank you, everyone.
So before I let everyone go tonight, first of all, I just want to say, what a fantastic discussion. I hope that you were able to glean something, and we will be having a number of these throughout the year. And if you can, we'd love for you to join a future one. You can find information about them on our website. we actually have another webinar slated for tomorrow, May 13th, just ahead of the American College of Cardiology scientific sessions. It's titled The Patient Pathway, Meeting the Needs of Patients Post-Cardiovascular Event. And we'll be discussing with both patients and providers the path that a patient takes after having his or her first cardiovascular event. And it's little known fact, or not as cited enough, that of the 800,000 Americans who have heart attacks each year, nearly 40% have a recurrent heart attack. And so what we're going to do on this webinar is kind of seek out why that's happening and how we can meet the needs of patients better to prevent those second and third events. You can register for that on our website at advancedcardiohealth.org. Thank you again for joining. We hope everyone has a great rest of the week. Take care.